I'm Chris Reichwam, current Chairman of the Board of Directors of the Benefis Health System Foundation, and I'm here today to talk about a project we are working on to improve the emergency department and the emergency facility here at Benefis Health System. With these funds, we'll be able to improve the size of the rooms. We will have a covered vehicle entrance. There will also be specialty rooms for patients that need to be quarantined or held separate from other patients in the facility. The rooms will be larger, which will help facilitate not only the patients but also the staff and doctors who are working with these patients, as well as family members who may want to be with their loved ones in this trying time.
As a pediatric hospitalist, I see a variety of children from birth to age 18. Some of them are sick, some are suffering from trauma, and some are suffering from medical conditions, including emotional and psychiatric disorders. A large number of these patients come through the Benefis Emergency Department. When this current facility was built, we were seeing an average of about 24,000 patients per year, and now it's well over 35,000. We believe that restructuring and remodeling this facility will improve patient flow as well as the patient experience and significantly decrease wait times. We need a larger number of specialty rooms, and the rooms themselves need to be increased in size. We also need to improve the way patients are directed in the flow of their care depending on their individual needs. An example of this is the story of Mike and Lindsay, a family from Havre, who presented to Northern Montana Hospital expecting an uncomplicated delivery of their second daughter.
On the morning of May 12, 2015, Mike and Lindsay Kellum went to Northern Montana Hospital for the birth of their second daughter. Lindsay was induced first thing in the morning. Since nothing had happened by 6 p.m. that night, the doctor decided to break her water to help move things along.
I don't think it was, it wasn't 10 minutes later, I don't think, and Lindsay looked at me and said, I don't feel good. And I thought, well, maybe, who knows what it could be, and then it wasn't 30 seconds later, she had maybe, I thought passed out, but I think as they told me later on that her heart had actually stopped. And of course, Dr. Leon and the other nurses and other doctors were obviously rushing, trying to get her down to surgery. They said that they needed to get the baby out right away.
On the night of May 12th, 2015, we got a call to dispatch from Northern Montana Hospital that mom and baby needed to be transported to Great Falls. Mom was in full code at that time, and baby's status was unknown as they had lost heart tones during the transport of mom to the OR. We were able to put two teams, both the adult team and the NICU team, with our isolate and their equipment on the helicopter, which is something that's never been done before, taking both teams, and we made our way to Havre.
They were going to bring Mercy Flight up, and then they were going to bring an ambulance up as well, and whichever Lindsay or the baby was worse, they would take in the helicopter and the other one would come in the ambulance. We knew the majority of the people that were nurses or doctors. You could just read on their faces that things weren't very good. So
when we got to the baby, we noticed that she was breathing on her own at the time, but having long spells of apnea, so she was holding her breath, and then also making some very obvious seizure-like activity.
When they brought the crew in, Stacy, who I did not know at the time, had gone upstairs and looked at the baby, and then they called me back up there and we were looking at her, and she said, you know, she looks really good, but she's having little tremors in her wrist and her hand, and as soon as she said that, you could see that as she would cry, she would squeeze her wrist.
And so very quickly we moved towards protecting her airway and giving her some medications to hopefully stop the seizure activity.
She explained, you know, lack of oxygen maybe to the brain when Lindsay's heart stopped and whatnot, and that she would need to go, she would be a very good candidate to go to Seattle and do what they do there.
So in order to get to Seattle, we had to bring our fixed wing up to Havre and switch out all of our equipment.
I thought I had heard at one point maybe a 50-50 chance to even get on the helicopter, and then whether she made it down there or not, because they couldn't get her bleeding to stop. I talked to some of the nurses that I knew and I said, hey, is there any way that I can go with her down there? And Joe was our pilot and one of the coolest guys you'll ever meet. He's like, oh yeah, you're getting on the helicopter with us. You're definitely coming with us.
In Lindsay's case, you know, we knew that she was bleeding. We knew that she was post-code, that they had done CPR on her. We knew, you know, we knew at that point that she was pretty ill.
She was on a ventilator. We knew she'd be going to OR most likely, so we were prepared for that, and OR was at least called and ready.
Mercy Flight lets us know that how many units of blood she's gotten thus far, how much fluids she's had, that her belly's getting bigger and bigger and bigger, filling with blood, that she's on the ventilator, that she's not able to maintain her own respirations. Her blood pressure was low because she had been losing so much blood. We knew she was sick, but until you actually laid eyes on her, you didn't know how sick.
After hearing what the doctor said in Havre and seeing the people in Great Falls, I think the suckiest part about the whole deal is you think the whole time, I don't know what's going to happen to the baby. I felt like she was going to be all right, but I had basically come to the terms like, how am I going to tell my 4-year-old that she's never going to see her mom again? You're just thinking about how you're going to go on with just you, and now you have 2 kids.
I remember coming to once, I believe I was en route down to the surgical room to have the C-section, and I didn't know what was going on at that point. And then I passed out again, and I don't remember anything until I woke up in Great Falls.
They took her into surgery, didn't know how long it would take, didn't really know what was wrong. Dr. Miser was the surgeon, I believe, and she came out and she was just like, yeah, no big deal. Got in there, found what was wrong, got her fixed up. I think she'll be fine.
Nobody really told me in real detail what happened until later on that night. And then the nurse that came in and explained exactly that I'd had what they call an amniotic fluid embolism. And basically amniotic fluid leaks into your bloodstream and causes a severe allergic reaction that in turn causes you to bleed, just completely bleed out. If you go by statistics, we're both very lucky to be here. It happens in 1 in 40,000 births, so it was extremely rare. We went into the hospital that day on the 12th thinking that we'll be home tomorrow with a new baby and everything will be fine. And 10 days later, and a helicopter flight and a plane ride and a drive to Seattle and back, we did come home with a new baby and got to start our little lives as a family of 4. But at the same time, with everything that happens, it definitely gives you a new outlook on life, and you're definitely grateful.
This story demonstrates the happy outcomes that can occur with access to highly trained professionals, but these professionals depend on state-of-the-art equipment and facilities.
We're fortunate to live in a community that has been so generous. And once again, we are asking the community to give to help make the emergency department all that it can be and that all that it should be.
We need your help to improve Benefis Emergency Department so that we can be prepared for all sudden and unexpected emergencies.